Joining us now is Dr. Robert Murphy. He's a professor of infectious diseases at Northwestern University Feinberg School of Medicine. Good morning, doctor.
Good morning.
So a little confused about the Johnson & Johnson. There are these various numbers. It's like 65% overall effective, but it's 85% preventive against severe disease. Because 65% does not sound great.
No, it doesn't sound great. On the surface, it looks terrible. But then when you dig down into this data with the 44,000 patients, whatever they had in this thing, you find some interesting things that are very favorable. One is that in the United States, the response was actually 72%, so 5 points higher than the overall response, because it was a worldwide project, including South Africa, where the response wasn't as good because of the variants that are going on there. If you look at prevention of severe disease, hospitalization, ICU admissions, all that, it's much better. It's like 86%. So you might get sick, but you're going to have a very mild case. So that's great. Also, nobody in the vaccine group had a related death. So this could have a tremendous impact. And it's just one dose, no boosters, and very easy to store. Like Robin said, it can just be in the refrigerator for several weeks or months.
So the good news out of nursing homes, numbers are way down because the people were vaccinated there. But there's also this interesting study from the CDC that says residents who recovered were reinfected with worse cases. So they're getting it twice?
Well, with every bit of good news we have, there's two steps forward and then one step back. So the decline in deaths in the nursing home was twice as great as in the general population. Now it's fantastic because nursing homes got targeted with these vaccines, so that's super. However, there is a report from the CDC, as you mentioned, in a nursing home in Kentucky. They don't say where, but 128 people recently became infected again, or let's just say recently became infected, and it turned out 90 of them had a vaccine in the past. So that clump is very worrisome. So it's got to be investigated.
It seems the UK variant is becoming the dominant variant. And it seems we don't have the ability to track this thing. How concerning is that?
Well, we do have the ability to track it, but we track it at a very, very low level. Now, CDC, just in the last couple of weeks, has decided or supported ramping up the sequencing of viruses, which should be around 5%. I don't even think we're above 1%. So, that's improving as we speak. I know there was a significant state initiative here to increase genotyping to see what's going on in Illinois. And we've identified some of the variants of concern in the state of Illinois, even in Rock Island recently. So that is getting better. But this variant is taking over in the United States. It's really out of control in California and Florida, and it's expected to take over in the United States within the next 1 or 2 months.
All right, here's some viewer questions. What's the status of the at-home COVID test? I thought an inexpensive, accurate test was being developed months ago. When is it going to be available?
Well, there's like 9 at-home tests, but there's 2 kinds of at-home tests. So one is where you're at home and you have like a little slit or something like that. You put the swab in your nose or whatever it is, and you do the test right there in your home, and it's cheap. Okay, so that's one type. The other type is you collect either saliva or a nasal swab, you put it in some cartridge or something, and you mail it to some laboratory, and then they send you the result when they get it. Now, it doesn't take that long. The mail has to get there, they have to do the test, and then they have to get the result back to you. But at least it's in the convenience of your home. Abbott has a test, Binax, that was approved at home, but you send the cartridge off, and then you get the result. So there's all those different things. The one that did get approved recently in the last couple of weeks was a company called Ellume. It's an Australian company, and they're opening up a manufacturing plant here in the United States. And that's one of those simple tests that you can do yourself and read the test there. And there's many others actually in the process of development that should be out within the next couple of months.
All right, next question. I received the Pfizer vaccine. My second shot was over a month ago. I had my antibodies drawn for COVID yesterday, and they came back negative. How do you determine if the vaccine is working?
Yeah, don't do the antibody test after the vaccine. Look at the data like we just talked about on the Johnson & Johnson vaccine and use that. that's better than doing these antibody tests. It turns out the commercial antibody test may be testing an antibody different than the antibody you got from the developed from the vaccine.
Ah.
So it's sometimes it cross-reacts and you get the positive, sometimes it doesn't. So it's actually not worth doing those commercial antibody tests after the vaccine. But this is actually a great question because we have to figure out if the vaccine is working with the variants that are available in the population. So it's important that we develop a test, but it doesn't exist now. So don't waste your time with what's available out there right now.
All right, one more question. My gym is again having hydrofit classes. While in class, everyone except the instructor who does not get into the pool removes their mask. There are less than 10 people in a full-size pool, so we're socially distanced. But should I wear a mask during class?
I don't see how you could possibly wear a mask in the water. I mean, to me, it just doesn't make any sense. If you have 10 people in a full-size pool, is a full-size pool a full-size Olympic-size pool? Or, how big is the pool? If you stay very far away from those people, you will probably be okay.
All right, Dr. Murphy, thanks a bunch. If you have a question for the doctor, post it on our Morning News Facebook page. We'll talk to him again on Monday.